The number of measles cases nationwide has now surged back to the highest number in 25 years.
Tonight, we're in your corner with what you need to know to stay protected after health officials release new details and one confirmed case of measles in East Tennessee.
And the CDC reporting now there are 626 confirmed cases in 22 states. This record could eventually surpass the 1994 record of 963 cases.
In East Tennessee, the Tennessee Department of Health announced today anyone who went to MAPCO on Browns Ferry Road in Chattanooga April 11th from 7:30 to 10 in the evening and Speedway on Orth Charles G. Seviers Boulevard in Clinton April 12th from 5:30 to 8:30 in the evening could have been exposed.
News Channel 11's Chantel Batista spoke to health officials and has more now on what Tri-Cities residents need to know.
It's tonight's top story at 11.
Measles is one of the most infectious diseases that we deal with. It's very, very easy to spread, and it's airborne.
A stern warning from the Tennessee Department of Health, which came with an equally stern prediction.
But I will be very surprised if we don't have a few more cases because it's such an easy disease to spread. So that will be expected.
While the health department did not identify a Northeast Tennessee location for potential exposure, the Sullivan County Health Department participated in an emergency webinar to prepare for a measles case, something they're hoping to prevent by getting out the word about measles, mumps, and rubella vaccination.
The one that may need consider getting the MMR is anyone who has not had 2 MMRs in their lifetime or they're unvaccinated. If you've had your 2 MMRs, you've got a 97% chance of protection.
Dr. May says it's uncertain we could see a case of measles in the Tri-Cities, but the issue lies within the unvaccinated population.
If we take 100 people in a room that's unvaccinated, 90% of those will get the disease.
He says a common misconception is that the booster shot is different from the MMR vaccine. Dr. May says the MMR vaccine is available at all local health departments and at primary doctor's offices.
If they're looking for specific measles boosters, it does not exist. When we give you a booster, we give you the MMR.
Officials say an unvaccinated person exposed to measles should get their vaccine within 3 days of exposure, and according to the CDC, symptoms may arise 7 to 14 days after the exposure.
So far, we've only had one case in Tennessee, and we're trying really, really hard to keep the numbers here low.
Some have criticized the way the state has released limited information about the East Tennessee confirmed case. Today, Tim Jones said information has come out in portions because it's been an ongoing interrogation to try to figure out which areas in Tennessee were exposed. The Sullivan County Health Department say they too will follow the state's protocol and only reveal information if they feel there was exposure to the public. Sarah?
Chantel, thanks. So how do you know if you have the measles and what should you do if you start to feel sick? Well, some symptoms of the measles include a rash, fever, or fatigue. The health department advises if you develop symptoms, stay home, contact your healthcare provider to make arrangements to see a physician without exposing others to the measles.